Thank you. So thank you for joining the webinar on the proposed changes to the Missouri Part B state plan. I'm Bev Ludkemeyer, Director of Special Education Compliance here at DESI. This webinar is being recorded. The recording, slides, and other documents from today's webinar will be posted as soon as possible. To find the recording, visit the Department of Elementary and Secondary Education, or DESI, webinar page at the URL listed on this slide, and click the recorded webinars button. This webinar is provided to you with the option of closed captioning because it's in Zoom. I believe there is also a place to click to request closed captioning. So the purpose of this public hearing is to allow stakeholders to hear about the proposed changes and ask any clarifying questions in the chat window. Responses to the questions will be posted on the DESI webinar page along with the recorded webinar. Comments on the proposed changes to the Missouri State Plan for Special Education can be made from November 19, 2021 through December 20, 2021, and may be emailed to idea.comments@desi.mo.gov. I think either Dana Welch or Stacy Holt will put all three methods for providing written public comments in the chat for your convenience as well. The Missouri Department of Elementary and Secondary Education, or DESI, Office of Special Education, is the administrative agency responsible for ensuring the implementation of Part B of the Individuals with Disabilities Education Act, or IDEA. The Missouri Part B program serves children and youth with disabilities from age 3 to 21. IDEA requires DESI to have policies and/or procedures to ensure that IDEA is implemented and the rights of children and youth with disabilities and their families are protected. IDEA also requires that the DESI hold public hearings and provide opportunity for the general public to comment before adopting any new policy or procedure. Today's webinar will serve as the DESI's first public hearing related to proposed changes to the state regulations for Part B of the IDEA. Reminder, we will not be taking public comments during the hearings. Any comments should be submitted in writing to the Office of Special Education by close of business on 4:30 p.m. on December 20, 2021. And the mailing address, the fax, and the email address for providing public comments are in the chat. So the purpose of this hearing is to fulfill the public hearing requirements of Part B of the IDEA and give stakeholders an opportunity to ask any clarifying questions on the proposed changes to the Missouri State Plan for Part B of the IDEA. We're here today to take clarifying questions only. Also, we ask that you please limit your questions at this hearing to the proposed changes. Responses to the questions will be posted on the webinar page. The following is an explanation of the hearing and changes process. 2 public hearings via webinar are held. The first is this one today, Monday, November 29, 2021. And the second is Monday, December 13, 2021 from 10:30 to 11:30 a.m. We are taking written comments on the proposed changes until the close of business on December 20, 2021. Following the January deadline for receiving written comments, sorry, that should be December deadline for receiving written comment, the DESI will review all comments submitted and make one of 3 decisions about each of the proposed changes. We will either make the change as proposed, make the change with revisions based on public comments, or not make any change. All comments received will be summarized and published on the DESI's webpage. The proposed changes will go to the State Board of Education. After the State Board of Education takes action on the proposed changes, they will be submitted to the Secretary of State's office for publication in the Missouri Register. The changes will become final after they have been published in the Missouri Register the required number of days. So again, here's the different ways that you can submit comments. So by mail, send mail to Department of Elementary and Secondary Education, Office of Special Education, attention, Part B State Plan comments, P.O. Box 480, Jefferson City, Missouri, 65102-0480, or by email to idea.comments@desi.mo.gov. Attention, Part B State Plan comments, or send a fax to 573-751-3910. Attention, Part B State Plan comments. Today's webinar will proceed as follows. I will read a summary of the proposed substantive changes. This summary will follow what's posted on the state plan webpage. I will pause periodically to read any questions that are received during the webinar. You may use the chat feature to ask your questions. Answers to your questions will be posted following the webinar. We will keep the line open or keep the Zoom open as long as we are receiving questions and until 2:30 p.m. If we are finished presenting the proposed changes and are receiving no questions, we will close the Zoom. We will now begin the public hearing for the proposed changes to the Missouri Part B State Plan. The first changes are in Regulation 3. First change is located on page 21 in Regulation 3. We changed human services to senior services in the name listed for the Department of Health. And this is to update to the current name used by that state agency, the Department of Health and Senior Services. The next change is also Regulation 3 on page 27. It's an addition of two titles to the list of qualified personnel who can evaluate and identify a health impairment. It would read, a student displays a health impairment when, 1, a health impairment has been diagnosed by a licensed physician, licensed assistant physician, Missouri State Board of Nursing recognized advanced practice registered nurse, licensed psychologist, licensed professional counselor, licensed clinical social worker, or school psychologist. The reason for the proposed change is that physician assistants and advanced practice registered nurses are authorized to evaluate and treat patients including prescribing medications, under the direct supervision of a licensed medical doctor. We hope that accepting diagnoses from physician assistants and advanced practice registered nurses is easier for parents, makes it easier for parents and school staff to get access to medical personnel qualified to evaluate children. Next proposed change is in Regulation 3 on page 42. The section with changes would read as follows. The public agency must promptly request parental consent to evaluate the student to determine if the student needs special education and related services, and must adhere to the evaluation timelines unless extended by mutual written agreement of the student's parents and the evaluation professionals. If prior to a referral, a student has not made adequate progress after an appropriate period of time when provided instruction, as described in the preceding section for specific learning disabilities, 4A and B, and 2, whenever a student is referred for an evaluation. So I should have read the number 1 prior to a referral. So the proposed reason for the changes is just to make it more closely reflect the formatting in IDEA in the sections referenced above. And currently the section describing a timeline requirement for determining eligibility using the criteria for specific learning disability, it's written as 1 paragraph. The proposed change integrates formatting used in IDEA and adds a reference to the specific learning disability criteria located in a preceding section. So we really just wanted to break up that run-on paragraph and make it easier to read, more understandable. The next change is in Regulation 4, identification and evaluation. The proposed change is found on page 50, and it would read as follows. 5, an individual who can interpret the instructional implications of evaluation results, who may be a member of the team described in 2 through 4 of this paragraph. So there is no, the reason for the change is there's no B or D in the reference paragraph. The 2 through 4 of that paragraph describes professional staff members from the LEA who would serve on IEP teams. And one of the people who can fill the role of an individual who can interpret instructional implications of evaluation results if they meet the requirements. So it's really a formatting change. The next proposed change is also in Regulation 4, located on page 52. Would read as follows. Other measures to ensure parent participation. If neither parent can attend, the public agency shall use other methods to ensure parent participation, including conference telephone calls or video conferences consistent with 34 CFR 300.328. So video conferences were not previously listed, and they are added to make it consistent with the IDEA statute referenced here, 34 CFR 300.328, which does include video conferences. So this next proposed change is also in Regulation 4. On page 54, in-state transfers would read as follows. If the public agency does not agree with the current evaluation report, it must initiate a reevaluation as described in the state plan. During the time that the reevaluation is being conducted, the agency shall implement the IEP as written from the sending agency or provide comparable services until the reevaluation is complete. So these changes are being made to be consistent with 34, with the IDEA regulation that covers transfer students. So transfer within the same state, and there's no requirement to develop an interim IEP. The next change is in Regulation 5, which I think should say procedural safeguards here. On page 66 in Regulation 5, we're adding the following section, the following sentence to the section describing parental consent for reevaluations. Informed parental consent need not be obtained if the public agency can demonstrate it made reasonable efforts to obtain such consent and the child's parent failed to respond. So the reason for this proposed change is to add this sentence describing an exception to the consent requirement included in IDEA in 34 CFR 300.300.c to make this section consistent with IDEA regulations. The next proposed change is in Regulation 8, personnel standards. The change in Regulation 8 is found on page 105. And the change is to remove the title, responsibilities, educational qualifications, and certificates or license requirements for speech implementer. And the reason for this proposed change is that local education agencies will no longer be allowed to use the speech implementer model beginning with the 2022-23 school year. So any of the proposed changes that I'm describing today would not be in effect until the 2022-23 school year. This change is also in Regulation 8 on page 106. We're proposing to change the title for teacher specialized instruction to teacher specially designed instruction. And the reason for the change is to make the term more closely match wording used in IDEA in 34 CFR 300.39A1. So the final set of proposed changes is in Regulation 16 for state operated programs. There are changes on pages 150 and 151. Two section headers are added to clarify the process for eligibility and referral. which made renumbering those sections accordingly necessary. The new section headers are MSSD eligibility review and MSSD referral procedure. So section headers added to more clearly identify the components of the eligibility and referral processes. Sections are renumbered to adjust for addition of the headers. So in regulation 16 on page 151, this reflects one of the formatting changes because of adding the section headers. And we read as follows. 3, at any time, the IEP team may determine, based on general functioning level and IEP goal progress, that the student is no longer eligible for MSSD because MSSD can no longer provide FAPE in the least restrictive environment. So the reason for this proposed change is to revise this section to make it clear that local public agencies are responsible for determining placement in the least restrictive environment, including, when MSSD is no longer the appropriate placement. So this goes with the previous proposed change, and it's showing some language that's removed from page 151. So this language is proposing to be removed because IEP teams should apply the process for determining least restrictive environment. The 2 examples given are not the only 2 possible reasons for making a decision to change what the least restrictive environment is. So this slide is a continuation. It just wouldn't all fit into one slide for page 151 and would read as follows. In such instances, the public agency representative convenes the IEP team, including a representative of MSSD, to review and revise the IEP to determine placement in the least restrictive environment. The team should consider IEP goal progress data, other existing data in the education record, information from the most recent reevaluation, and any relevant medical information. The public agency will provide the parent with prior written notice of the change in placement and change in services. So the reason for this proposed change is that when MSSD is no longer the appropriate placement, the public agency must convene the IEP team to change the placement in the least restrictive environment. And we're removing the reference to transfer student process because the local public agency was responsible for determining placement when the student attended MSSD and continues to be responsible when placement in the least restrictive environment changes for a student that's at MSSD. So that concludes the description of proposed changes. Let me check the chat. I see one question in the chat. It says regulation 8, page 106. Will this change specialized instruction to specially designed instruction wording on the IEP services summary section? And just reminding you that we're not answering these questions today. but we are going to read them to you and answer them in writing, which will be posted on the website. So I will leave this slide up for a few minutes and keep checking the chat box. If any new questions pop up, I will read them out loud. Other than that, when we don't have a question for between 3 and 5 minutes, we'll go ahead and close this Zoom. So it's 1:55 now. So I posted the slide that has the public comment methods in it for mail, email, and fax in case you want those again. They are in the chat. They're probably easier to copy out of the chat if you want to copy and paste those. So we've had 3 minutes without any comments. We're going to give it a couple of more minutes before we close the Zoom. We've had 4 minutes without any new questions. Well, It just clicked over to 2. So we've had 5 minutes without any new questions. So we're going to go ahead and close this Zoom. Thanks everybody for joining us and participating.